1811-4000। यही कंज्यूमर हेल्पलाइन।
Good evening. Does the death of 14-year-old schoolgirl Rida Shaikh show that in the face of a possible public health emergency, there is urgent need to take swine flu testing and treatment out of the government's control? Panic in Pune today. Hundreds of parents rushed to a single hospital for swine flu tests. 3 more hospitals in Pune are now designated swine flu testing centers. Meanwhile, there is widespread anger against the hospital and doctors in the Rida Shaikh case. The family's lawyer says this is a case of criminal negligence. That brings us to our question of the day. It's my idea question of the day. Pune doctor accused of negligence in H1N1 case. Are doctors a soft target here? Type QTD space Y for yes, QTD space N for no. SMS to 51818. You can also vote online and express an opinion on ibnlive.com. Why not do that? This is an issue that is exercising large numbers of people across the country. Facing the nation tonight, Asif Lampwala, lawyer and counsel to Rida's family. He is the gentleman who made that charge of criminal negligence of the doctor and hospital. We have Dr. K.K. Agarwal, very senior cardiologist, President Heart Care Foundation of India and member of Faith. Right here in our Noida studio, Dr. Sandeep Bagai, Director and HOD of Pediatrics at Rockland Hospital, also Padma Shri, may I add, and H1N1 Khanna, Managing Trustee, Consumer Voice, the voice of the Aam Aadmi, the voice of the citizen. Before we begin our discussion, the top story on Face the Nation, Rida Shaikh's death highlights the gaps that perhaps exist in the way medical authorities are dealing with the H1N1 virus. Here's a report.
Anger, fear, panic outside Pune's government-run Naidu Hospital.
Look at the hospital. Look at the place. People who are not even infected, they will get infected looking at the test scenario.
14-year-old Rida Shaikh's death from the H1N1 virus has set off a wave of panic in the city.
What is your number? You give me your number actually.
That ended up at the Naidu Hospital. The hospital clearly not equipped to handle this sudden swell of suspected flu patients. Lines were broken, tempers lost, and medical staff left trying to get some order in place. Even those whose patients were screened were still unsure if the hospital had cleared them of the swine flu or not.
They are not doing a test. From 103, our temperature is not going down since 10 days. And now after this Jangi case, none of the private doctor is doing any treatment. They are all sending to Naidu. No medicine is available in the chemist. Then what to give the child?
But has Naidu treated her?
No, they are just seeing and they are telling tonsillitis. But why they don't give in writing that it is only tonsillitis?
The government then designated 2 more hospitals in Pune for screening, Aund and YCM in the suburb of Pimpri. But most people said they were unaware of them and put the load on Naidu.
Children should tell their parents not to panic. There's a panic situation in the city and children have to behave responsibly to control the situation.
Here at the quarantine ward in Pune's Naidu Hospital, things seem to be under control for now.
But angry questions remain, many asking why there are just 3 hospitals designated for screening and testing and why private clinics are being kept out. The Maharashtra government has completely ruled out private clinics for the time being, but is reportedly looking for other suitable hospitals in Pune that could ease not just the fear of residents, but also the pressure on this hospital. With Prachi Jatanya in Pune, Sohasini Heather.
Very serious scenes of utter panic there in Pune. Concerned parents, very, very concerned about their children. Let's get to the initial results now of our SMS poll. The Pune doctor accused of negligence in the swine flu case. Are doctors a soft target here? What are you telling us at the start of the show? In fact, 54% are saying yes. So the sympathy there is slightly with the doctor. Let's get straight into Crossfire and Face the Nation. Mr. Asif Lampwala, you are the counsel for Rida's family and you're bringing a charge of criminal negligence. Now, is it appropriate for you to blame the doctor right away before the government inquiry has completed its investigation?
No, government inquiry is an independent procedure. We are blaming the management and one of the doctors that treated the patient. We are blaming the management simply because we don't understand why the sample was sent to Ruby Hospital, a private hospital, when there's a government notification which says that the sample should be sent to a designated laboratory stroke hospital. There is a government notification to that, and designated laboratories have been defined in that. Didn't the Jahangir Hospital know about this? If they didn't know, they have acted negligent. If they knew and they still sent it, I don't know. Why did they do it? So I think I'm making myself very clear as to why we are going ahead with this.
But Mr. Lampwala, a number of doctors have said that often patients blame the doctor when there is a death. This is a way of coming to terms with their grief. They need a scapegoat. The doctor has to be made into someone who they can blame.
I don't think so. The relatives are not really doing something for money or because they can't deal with the grief. They want the world to know what has happened to their child. They want the people to know how a private hospital has treated their child. They want the world to know that there is more than meets the eye. Two hospitals have had a nexus. They're just trying to make some money, I guess. They want to teach the management, the doctors, a lesson.
Sandeep Bagai, how do you respond to that? That this is criminal negligence, a lesson has to be taught. There's a nexus between this hospital and that Ruby Hall where the sample was sent for testing.
Right at the offset to everyone, especially to the family who's lost a small child, my deepest and heartfelt condolence. Nevertheless, I think anything which we say on national television or in private, I think needs to be validated. We need not shoot the gun much before the target is in front of us. We have to go through the case file. The clinical presentation of any influenza or any upper respiratory infection, be it viral or bacterial, can be exactly the same. An influenza-like illness can progress to an acute respiratory distress syndrome, which apparently this child had. This child was on a ventilator, as we are informed on the television. I do not think under any set of circumstances
this was negligence.
I do not think under any set of circumstances you can label any case as being criminally negligent or with civil damages or gross negligence unless and until an independent body reviews the case.
That's a very interesting point. Now, medicine, where do you decide where negligence steps in and complication begins?
You see, negligence has been defined very well. What if a doctor does or does not do what a reasonable medical practitioner would have done in a given situation is negligence.
But the symptoms look like pneumonia, as you were saying.
No. The question here is, negligence has to be proven beyond doubt in a criminal court.
Correct.
And proven in a civil court.
Correct.
And also proven in a consumer court.
Correct.
And let me tell you, 95 out of 100 cases filed by angry lawyers such as him eventually fail in all these three courts.
Correct.
And the single reason why they fail, even when there are deaths on record, is because medical experts, other medical experts, do not come to give evidence against a fellow medical practitioner.
So a doctor is never punished. A negligent doctor is never punished.
Let me tell you.
K.K. Agarwal?
Dr.
K.K. Agarwal, is that the fact?
Yes. No, that's not a fact. If you see most of the states, actions are taken against doctors if they are found to be, if there is any error, if there is any difference of opinion. I mean cases are there. We need to understand that error of judgment is not a crime. Difference of opinion is not a crime. These two things we must know. A medical accident is not a crime. It's different from medical negligence. You need to prove that it was not a medical accident, it was not a difference of opinion, it was not an error of judgment. Now, we need to understand that human flu and swine flu cannot be differentiated clinically, 1. 2, for the Tamiflu is only effective if it is started in the less than 48 hours. 3, 5 lakh people every year die because of flu complicated with pneumonia all over the world. Simple flu, people are dying. So, one death does not mean that there has to be so much panic in the country. Even routine flu, even it was not a swine
No,
flu.
but that's very
even
worrying.
then the children or the persons can die.
No, but Dr. Agarwal, that's
No.
very worrying, Sriram Khanna. If a doctor is actually not aware enough of the possible repercussions of H1N1 and actually says this is pneumonia and continues to treat for pneumonia, then why is the doctor not being blamed for this? He should be blamed. He should be blamed for not understanding the context in which the disease has happened. The first thing he should have done is send for swine flu testing.
See, what he is saying is, Mr. Agarwal, Dr. Agarwal is saying is correct. I agree with him. And that's exactly what happens when 95 out of 100 cases fail. Because doctors like him come into the witness box on the side of the hospital or the accused doctor and try to prove that it was not negligence, but it was error of judgment, it was difference of opinion. And that is why 95 out of 100 cases fail. Number two.
Dr. Agarwal, let me get a response.
Let me give you an example. Let me first give you an example. If there is a high court, if there is a district court put somebody on death sentence, high court says no death sentence, and Supreme Court says no death sentence, if the person would not have gone to high court, and if the death sentence by the lower court was, is that negligence by the district court judge? No. This is error of judgment. Error of judgment is not a crime all over the world.
No, but Dr. Bagai, if no doctor is ever punished for negligence, then there is no fear among doctors that they will be punished for negligence.
Okay.
So what is the incentive then not to be negligent?
There are two issues in this. Just let's focus on the issue first of this child. This child was ultimately diagnosed to have an H1N1 influenza illness. Upper respiratory infections and lower respiratory infections can be thousands in type. Out of those many thousands, one amongst them is influenza. Influenza itself is of A, B and C types. In type A, you have more than 140 serotypes of influenza. Just bear with me for a second. Out of this, one amongst them is H1N1. This is a very mild, many times a subclinical disease. For every child which we see with suspected illness, there are hundreds in the streets, in the society,
H1N1
which have
is the
fought this
first
infection
thing the
away.
doctor should have
Not
suspected.
true. Not true. The reason simple is.
Pune is the epicenter of it.
I'll explain to you why. The clinical presentation of these sort of children looks exactly the same like bacterial pneumonia. Bacterial pneumonia and other illnesses are much more common than H1N1. If we think of a common car on the road, we do not think of Ferrari as number one. This is one amongst the diagnoses which we keep in mind, but it's not the first diagnosis which we keep in mind, even at the present moment.
We don't keep H1N1 as the first
Not
diagnosis.
as the first diagnosis for a child presenting with fever, cold and cough. We keep that in mind. Second thing is, we need to start analyzing the child. Does this child require the requisite test for H1N1? There are lots of random screening tests, but the main test, Sagrika, the main test is known as a real-time PCR test. It's a polymerase chain reaction test. This is not very, very cheap. It costs almost 8 or 10,000 rupees. This test has to be used with jurisdiction and with wise counsel.
Right.
This is not a test which we use as a mass screening for a population.
But
thirdly,
Yeah.
Khannaji, is the medication of Tamiflu is to be started if you're suspecting it within the first 24 to 48 hours. Very often the clinical presentation of a child has not
But
evolved.
that's very, very worrying.
That it is.
That's very worrying.
So
There could be more potential Ridas out there.
This is the clinical dilemma. The point is the clinical
So you
picture
think the
may
disease presents a clinical dilemma?
you may not present
But that is
as
even
an
more
evolved
Listen.
disease in the first
What
48
he
hours.
is saying, I don't agree with. I have traveled in the last 1 month to 3 countries, and in every country, at the airport entry, anybody showing symptoms of cough, etc., it gets a preliminary screening, and they say, okay, you don't need a detailed test, and wherever they suspect, the first thing they're looking for is H1N1. And in Pune, which is the epicenter, if all the medical doctors are not on high alert,
That's what I'm saying.
then
Why are they on high alert for H1N1?
that means the doctor here is only defending his own. That's what he's doing.
No.
Of course, that's what you're doing.
The influenza virus infection is one amongst the many which involve
But
the
Dr.
respiratory
Bagai,
tract.
you're saying something very, very frightening. You're saying a child is presenting symptoms. It could be H1N1, but it's presenting the doctor with a clinical dilemma. He doesn't know whether it's H1N1
No,
or
but in
something
this
else.
case, they took a sample and sent it to the wrong place.
No.
Isn't
The
that
That's
question
the
negligence?
other, and that is in fact
the
negligence.
only
That is in
test-
fact negligence.
The
Sent it
only
to the wrong
test,
place.
here I'm stressing, the only test which proves one way or the other is a real-time PCR test.
Okay, let's
There is
get in
no
Dr.
other
Agarwal.
test.
Let's get in Dr. Agarwal who wants to respond to that.
Sagrika. Number one, in Mexico and in US only 2% of the people required hospitalization. In Mexico only 6% have needed hospitalization. People who do not need hospitalization, who are milder cases, the WHO has clearly recommended not to do tests. They say do not waste your resources for people who are having mild symptoms. Unless you are suspecting pneumonia,
But the hospital
H1N1
sent it to
screening
the
is
wrong
not necessary.
lab.
No, this is a case of hospitalization.
first
They
of
should
all,
have done this.
Even if you were known that it was a H1N1, if the treatment is started after 48 hours, there is no data to say that Tamiflu saves life. Once a patient has pneumonia, 70% mortality is there, even in the US, even in the Mexico, even in the Canada. So what I am trying to say, there is no way you can say that if this patient would have been in a government hospital, he would have survived. Tomorrow, if somebody dies in a government hospital, then people will say he died
No,
because
but
he was
this
in a
is
government
all
hospital.
very,
If
very
he was in a
frightening.
private
Listen, I
You're
don't.
saying Tamiflu doesn't cure.
Sagrika,
You're saying the doctor has a
Sagrika,
dilemma.
I'll
And
tell
you're
you
saying
what
the
the-
See,
doctor.
my friends here,
The
both
situation
are
of
doctors,
Khanna
There
ji,
is
and
no
this is
data
precisely
to
what I'm
suggest that
saying.
Mr. Khanna, if you have a cold and cough,
Yeah.
if you have a cold and cough,
Yeah.
it may be very mild in the first
Certainly,
2-3
I
days.
agree with
But we're
you.
living
Hear
in
me
a
out.
situation
Listen,
of H1N1.
I want
So
to say-
therefore, you cannot start Tamiflu if you're
fact, he
coughing
has a
right
cough.
now. So you're
Listen,
coughing right next to
listen,
me.
there
So
is
I'm now scared.
In normal
Now
times,
the point is,
in normal
Let me-
times, you're
let me-
right. But when there is a WHO alert of a pandemic, when government of India has issued an SMS
Right.
and saying this is what
I'm
it is,
sorry, Mr.
then
Khanna, you
I'm sorry.
cannot
Okay, let's take a
screen
short break at this
every
point
patient
and come
No,
back
a
and talk about
patient-
the
and
other
fever.
A
dilemma
patient who
of
is hospitalized
H1N1,
is not to be
which is
screened.
that should it be
Needs to be
taken out of government control. That's after the break.
No,
Because of the doctors only the child suffered. If the doctors would be, I mean, they don't know what they are doing, where will people go?
Making doctors a soft target is not going to serve any purpose or not going to take any case forward. What is important is understanding what happened in that particular case.
It's systemic failure rather than an individual's failure which causes cases like these where a young life has been lost.
Unless and until the facts that actually what has happened comes out, it would not be right to point fingers at anybody.
I don't think the administration is doing enough. I mean, why can't there are a whole lot of private clinics, why don't they authorize them to do this testing rather than just have two hospitals doing this whole thing?
Welcome back to Face the Nation. In fact, there is anger at the death of Rida Shaikh, the first casualty of H1N1. And in fact, the lawyer and counsel for the family are threatening to file criminal negligence against the doctor. Now, we're asking, are doctors soft targets in this? What are you telling us midway through the show? In fact, there you have it, 54 yes, 46 no. Carry on voting. We'll carry on with our discussion. Mr. Asif Lampwala, is it the fault of the management that there was this terribly tragic casualty, or is it the lack of proper swine flu testing centers? Should there just be more testing centers? Should private facilities also be allowed to test so the testing centers are readily available to a suffering child?
Yeah, because they're complicated tests for it. They're complicated tests. All the hospitals cannot do it. There are only defined laboratories that can actually conduct the tests. Ruby Hospital did the test in 1 hour. I mean, how could they do it? How can they complete the test in 1 hour? When the test normally, I've been told, takes about 12 hours.
No, what is this but negligence? You're sending a case of H1N1 to a lab which is doing a test in 1 hour, which should take 12 hours.
I think a very fair statement on my part would be that which sort of test was conducted. Was it just a screening test or was it a diagnostic test? We don't know. So it will be unfair to blame point A or point B on this. But
See,
you know, go ahead.
But if any lawyer,
no, go ahead. See, if the gentleman, the lawyer, he knows the Supreme Court has recently held on this issue. No police station in this country can register a criminal negligence case against a doctor without medical expert evidence that there was negligence. I'd like to ask this gentleman, have you found a doctor in Pune who is going to stand on your side and say there was criminal negligence? Have you found a doctor?
That's exactly the point. Dr. Agarwal, even if the government conducts an inquiry, that inquiry will be conducted by doctors. And doctors will look after their own. So doctors can get away with murder. In this case, a doctor can get away with a negligent act.
That's not correct. Listen, let me give you an example of State Medical Council of Delhi. There are in the disciplinary committee, it is headed by a doctor, but there are MLA, there are one social activist, and there are one NGO. There are out of 6 people, 3 are non-doctors, and they decide the disciplinary case. Every case of Delhi go to the DMC committee. Therefore, you cannot say that.
No, he's right, but how many doctors have been debarred by this committee in the last 10 years?
Let me
give
you
not one.
Give you an example. No, let me give you an example.
And how many inquiries have
in
actually been
Hyderabad,
conducted?
one doctor has been fined 1 crore. In Hyderabad, one doctor has been fined 1 crore. This is only one month back. 1 crore fine has happened in the Hyderabad case. You can't say doctors are not being fined.
I think it's very easy to stand on a forum like this gentleman, respected lawyer, is doing.
So you were saying he has no right to come on national television
but the
and
fact
debunk
is,
doctors.
has he taken a medical expert opinion of his choice to validate what he's saying before he's actually made the statement to actually accuse a doctor or a hospital? Point number 2. It's very nice to appear very magnanimous and very bold and very caring. He said, we don't want this money, but we are going to sue this hospital for a lot of money. We are going to give this to charity.
At the same time, Shriram Khanna,
is he doing this for charity? Is he fighting this case free?
Okay. So you're saying his motives also could
Let's
be
have a level playing field.
See, I have not met many lawyers who will continue to, cases like this will take years to go. And I have not met many lawyers who, for television, they will say, yes, we'll do it free. But after 2 hearings, they'll say, now I'm busy, you find somebody else.
But but at the same time, I think that a very grim prognosis has been reached here on this program, that in fact, if a doctor is accused of being criminally negligent, there is very little chance that he will actually prove to be criminally negligent, because the people actually conducting the inquiry are doctors who will look after their own.
Sagarika, Delhi Medical Council as a state
council
actually
contesting that though.
Is a very, very fair body.
Okay, it is a
and
fair
it's
body.
We don't agree with that. There are several cases we know.
Disagreement on this.
There are several cases of death by negligence which could not.
It's a common man's understanding to blame death as a negligence, whereas it's a consequence of a
complication. But on the other hand, we must also realize that a doctor is not someone just to blame as an outburst of grief. Thanks very much indeed. Asif Lampwala, Dr. K.K. Agarwal, Sandeep Bagai, Shriram Khanna, thanks very much indeed. Are doctors soft targets in the H1N1 case? 55% yes, 45% no. The majority there believing that doctors are soft targets. They are not to blame. Thanks for watching.